I was real close with my father. He was a doer, Canadian immigrant that came to this country, loved this country, got in the olive business and became very successful. So from a very early age, I was around all of the plants out to the orchards. I've always kind of been acclimated toward the outdoors. The first time I noticed the shortness of breath was 5 years ago working on a piece of property unloading lumber. And by the time I got it stacked over there, I realized I was absolutely out of breath. Eventually went to a pulmonologist, and I noticed on some of his paperwork when he jotted down congestive heart failure. I knew then that this is more than a little breathing problem.
When I saw Mr. Trafton in clinic, he was very frustrated with his symptoms because he was a very active person, and gradually over the period of a few weeks, he would get short of breath with minimal activities.
Living in a rural environment like this, there's things that have to be kept up with. But I did have to just leave projects aside, and well, I'll get to them later, which meant I'm probably not going to get to them.
You had someone in here who just had that same amount of energy, but the body wasn't allowing him to do it.
In his case, he has a leaky mitral valve, meaning when the heart contracts, instead of the blood going to the whole body with oxygen, it goes back towards the lungs. The lungs are overwhelmed with extra fluid that leads to shortness of breath, and the body gets less oxygen. When I saw him, he had no options because of his heart failure. He was not a candidate for open heart surgery.
If this condition is not treated, essentially that added stress to the heart will lead to progressively worsening symptoms, worsening heart failure, and ultimately death.
I kind of figured that I was coming to the end and was grateful for all the things that I had been able to do and see during my life, but I wasn't really planning on much beyond another year, maybe 2 years.
If the patient is not a candidate for open heart surgery, the other option will be transcatheter repair. The problem is that he was not an ideal candidate.
In my particular case, the procedure was a little problematical because of a heart deformity.
In most cases, when patients have mitral regurgitation, the leakage is in the middle. In Mr. Trafton's case, the challenge is that the leakage was closer to the top part. And the device is not designed for that, and the results are not guaranteed.
But in the end, he said, if you were my family member, I would recommend it. And I said, let's do it.
Things went exactly as planned. His recovery went great. He gradually improved, till in a month he told me he was better than he was before.
Taking someone who, didn't have any hope or options, right, to seeing them and joking with them, walking around and seeing him climb upstairs and kind of a new outlook on life. That's probably the most satisfying part of the job, is seeing the after effects.
It's just been a life changer. It really has. And I do think it's a collaboration between disciplines that's unique to Loma Linda. It means a great deal to me. There's things I want to do, and I'm re-engaging in things. I'm going back to work at 76 years old. It's one of the things I enjoyed most in my life. I really am focused on every day. There's a tremendous increase in my quality of life. I'm glad I have a future.